thank you for watching the video. This is YouTube Medical University. This time, we'll talk about 6 healthy lifestyle habits for your liver. The liver helps digest food and detoxifies your body. It's a very important organ for our survival. In fact, some of my patients who come to my clinic have damaged their livers, which caused their skin to turn yellow and led to life-threatening complications. They often say they wish they had taken better care of themselves sooner. It's said that 1 in 3 Japanese people has fatty liver. Fatty liver is a condition where fat accumulates in the liver, making it look like foie gras. If you leave this untreated, inflammation will occur and your liver will gradually become harder and harder. Just like when your skin gets injured and forms a scab, once your liver becomes hardened, it can't return to its original state. When you develop cirrhosis of the liver, you may lose consciousness or your blood may stop being produced, leading to anemia or shortness of breath. The balance of blood flow can be disrupted, causing massive vomiting of blood, which can be life-threatening. And this cirrhosis of the liver also increases the risk of liver cell cancer. Hospitals receive medical fees by detecting diseases early and providing treatment. Sharing knowledge to prevent illness and methods for early detection doesn't benefit hospitals. However, what's important is to avoid getting sick. It's important to reduce risks or avoid getting sick in the first place, even before the onset of illness, right? At YouTube Medical University, we responsibly and clearly share ways to prevent and detect diseases early from a doctor's perspective. If you'd like, please subscribe to the channel so you don't miss any new videos. Now let's get started. Here is the first of 6 ways to improve fatty liver. It's coffee. Isn't that surprising to everyone? In fact, coffee has been shown in various studies to suppress fatty liver and prevent cirrhosis. Such research results are being reported one after another. In fact, the preventive effects of coffee are also mentioned on the website of the Japan Society of Gastroenterology. According to a report from the National Cancer Center of Japan, it has actually been reported that coffee has a preventive effect against liver cancer. In a study involving 90,000 Japanese people aged 40 to 69 coffee, when comparing people who drink a lot of coffee with those who don't, those who drank more coffee had fewer cases of liver cancer. People who drink coffee every day had half the risk of liver cancer compared to those who hardly drink any. Furthermore, there are reports that people who drink more than 5 cups of coffee a day reduce their risk of liver cancer to 1/4. Incidentally, this effect was not seen with green tea, which also contains caffeine, so it's believed that components in coffee other than caffeine may have a positive effect on the liver. I think many people are surprised by the effects of coffee. However, deciding to drink 5 or 6 cups of coffee a day just because of this can be a bit risky. That's because drinking too much coffee could lead to excessive caffeine intake. Research from the University of Toronto has also reported that consuming too much caffeine in a day increases the risk of high blood pressure. To prevent negative health effects, there is a recommended daily limit for caffeine intake, which is the guideline is about 300 to 400 mg per day. If you drink a can of black canned coffee, the caffeine content is it contains about 100 to 150 mg, so remember that about 3 cups a day is the guideline. By the way, caffeine should also be avoided by people with heart disease or mental health conditions. And pregnant women need to be especially careful. I've summarized the video about the risks of caffeine here, so if you're interested, please check it out from the description below after this. Here is the second of the 6 ways to improve fatty liver. It's to consume healthy fats. Fatty liver is when fat accumulates in the liver. Since fat accumulates, many people think it's better not to consume fats. However, consuming certain types of fats can actually help prevent lifestyle-related diseases, and there are many reports that say it may help prevent diseases caused by clogged blood vessels, such as heart attacks and strokes. The healthy fats for your body are these omega-3 fatty acids. Omega-3 fatty acids are found in fish oils and olive oil, and also in oils like perilla oil and flaxseed oil. On the other hand, fats from red meat or salad oil can actually worsen fatty liver, so you need to be careful. Just by changing the type of fat you use on a daily basis, you can expect very good effects for fatty liver. The National Cancer Center conducted a study on men and women. In a study involving 90,000 people, there are even reports that the group consuming omega-3 fatty acids reduced their overall cancer risk. So please make an effort to actively consume healthy fats. I also practice this myself. As for dietary methods, I recommend increasing your intake of blue-backed fish instead of meat. Consuming too much red meat such as beef, pork, as well as ham and sausages actually increases the risk of colon cancer. Therefore, it's better to get your daily protein from sources that contain omega-3 fatty acids instead of red meat. Try switching to blue-backed fish. Just increasing your weekly intake of blue-backed fish by 100 grams can help reduce your future risk of heart blockages and strokes. The risk decreased. There are reports that the more you consume, the lower the risk becomes. And nuts, especially the fats found in walnuts, are also said to be good for your body. In fact, I usually eat them when I get a little hungry. By switching from things like chocolate to nuts, I'm actively trying to consume healthy fats. How to improve fatty liver. The third of the 6 tips is to cut back on alcohol. Actually, our liver works to metabolize alcohol. If you drink too much alcohol every single day, your liver has to work non-stop and it can get exhausted. And the alcohol that your liver can't process ends up being stored as fat in the liver, resulting in fatty liver disease. So, how much do you actually have to drink before your liver gets damaged? Here are the guidelines. For example, if you drink 500 ml of sake a day, which is quite a lot, and keep that up for 5 years, the risk of developing fatty liver increases significantly. And if you drink 900 ml of sake a day, which is quite a lot, for 10 years, many people end up with cirrhosis, a condition where the liver becomes hardened and can't return to normal. In other words, for your liver, please remember that alcohol is your liver's worst enemy. But you might be thinking, I've often heard that alcohol is the best of all medicines and that drinking in moderation is good for your health. Is that really true? That's partly true, but it's important to look at the overall picture. It's true that in cases like myocardial infarction, where heart blood vessels become blocked, the risk of disease goes down for people who drink a little alcohol. However, if you go over a certain amount, the risk starts to go up. On the other hand, for things like breast cancer or esophageal cancer, there's no evidence that drinking a small amount lowers the risk. In fact, even a small amount of alcohol gradually increases the risk. So, is there actually a guideline for how much alcohol is okay to drink? The Ministry of Health, Labour and Welfare says that the appropriate daily alcohol intake is up to 20 grams per day. 20 grams of alcohol is about 1 medium bottle of beer, or roughly 1 serving of sake, or 1 350 milliliter can of 7% can Chuhai. The Ministry of Health, Labour and Welfare isn't saying that alcohol is absolutely forbidden either. If you can keep your alcohol intake low, it's fine to drink within the suggested amounts. But remember, excessive drinking raises the risk of liver cancer, esophageal cancer, and other health problems, so don't overdo it. And take this opportunity to consider cutting back on alcohol or setting up alcohol-free days. The fourth method for improving fatty liver is to lose weight. Fatty liver is a condition where fat accumulates in the liver. Fortunately, by losing weight, you can improve fatty liver. Many of my patients have successfully incorporated exercise and made dietary changes to lose weight and overcome fatty liver. As a guideline, it's said that reducing your body weight by 5% can improve fatty liver. For someone who weighs 50 kilograms, that's about 2.5 kilograms. For someone who weighs 60 kilograms, that's about 3 kilograms. Doesn't it seem achievable if you put some effort into your diet and exercise? For those of you thinking, if losing weight were that easy, I wouldn't be watching this video and I wouldn't be struggling. Instead of trying to force yourself to start a brand new exercise routine, please try incorporating exercise into your daily life. How about making small changes like that? For example, if you're watching this YouTube video while lying down, try standing up instead. When you're at work or going shopping and usually take the elevator, try making a rule to use the stairs instead, at least on the way there. Or while you're microwaving your food, you could set a personal rule to do squats just during that time. By making small changes like these in your daily routine, let's gradually become healthier together. And actually, overdoing exercise can put extra strain on your joints, and in fact, there is data showing that it can even harm your health. Even just walking 2,000 steps a day, which takes only about 20 minutes, has been shown to have health benefits. If you feel like you can manage a bit of exercise, I've posted videos about exercise in the past, so please check them out from the description at the end. Here is the fifth way to improve fatty liver. It's to get regular blood tests. When your liver is getting weaker, there are usually very few early symptoms. On the contrary, by getting blood tests, you can detect liver problems and fatty liver at an early stage. Values like aspartate aminotransferase, alanine aminotransferase, and gamma-guanosine triphosphate are useful indicators. And if your fatty liver gets worse, actually the most common causes of liver cirrhosis are hepatitis B and hepatitis C. Did you all know that? In the past, it used to be widespread due to things like mass vaccination programs. Now, effective treatments have been found for hepatitis B and hepatitis C, and especially for hepatitis C. If it is detected, there are many people who can be treated and improve. And as for hepatitis B, it's also common to contract it as an adult through needle stick accidents or as a sexually transmitted infection. I think it's also important to have regular blood tests so you don't miss hepatitis B or hepatitis C, which both carry a high risk of cirrhosis. Please be sure to consult with your primary doctor or a nearby physician. The sixth way to improve fatty liver is to get an imaging test, as shown here. This is also similar to a blood test. Actually, fatty liver can be easily detected with an ultrasound. Because fat accumulates in the liver, it appears brighter than a normal liver. The liver shines with fat and shows up on the ultrasound. That's the general idea. However, if the ultrasound beam doesn't reach well, or depending on the examiner's skill, fatty liver can worsen. There is also a possibility of missing cirrhosis or liver cancer, people who are at high risk. For example, people who have hepatitis B or hepatitis C regularly have their tumor markers measured through blood tests, and it is recommended that they undergo liver ultrasounds or MRIs. When the liver starts to deteriorate, there are indeed some unexpected signs, which I'll talk about later, but sometimes these signs can be missed, or there may be no symptoms at all. In such cases, tests can be helpful. With an ultrasound, there's no radiation exposure and no pain. So, when you go for a health checkup, I recommend adding it as an option or taking it together with other tests. Please consider having regular liver checkups. How was it? This time I introduced 6 ways to improve fatty liver. The first one is coffee, which I explained can lower the risk of fatty liver, liver cirrhosis, and liver cancer. The second is oil. In fact, there are oils that are good for the liver and lifestyle-related diseases. I introduced omega-3 fatty acids, which are found in fish, nuts, olive oil, and flaxseed oil. The third is alcohol. I mentioned that while drinking a small amount might be slightly good for the heart, drinking too much increases the risk of liver cancer, breast cancer, and esophageal cancer, so you should be careful not to overdrink. The fourth is losing weight. If you have fatty liver, you can improve it by losing weight. Please try to be creative with your exercise and diet. Try your best to lose even just 5% of your body weight. The fifth and sixth points were blood tests and imaging tests. By regularly getting tests like aspartate aminotransferase, alanine aminotransferase, gamma-guanosine triphosphate, as well as ultrasound and magnetic resonance imaging, you can detect dangerous signs from your liver, which often doesn't show early symptoms. Regular health checkups are really important. What did you think? In today's information society, the internet is overflowing with all kinds of information. There are many things you can learn from, but some information is incorrect. To avoid being misled by such information, it's helpful to remember not only why something is good for your body, but also what kind of data supports it. That way, you're less likely to be fooled by false information. At YouTube Medical University, we will continue to share easy to understand and responsible information with the theme of enjoying a healthy life. If you like, subscribing to the channel would encourage us. Also, whether it's a thumbs up or a thumbs down, we'd appreciate it if you could rate this video. And in the comments section, please share the lifestyle habits you practice. And please share what your doctor told you at the hospital.